Hi friends, welcome back to Complete Medical Coding. Today let's discuss practice questions from the Pathology and Laboratory section, the 80,000 series. It's an important part from the CPC examination, and also it's very easy to score marks in this from this section. Okay. In the last video, I had discussed about the CPC examination pattern, what type of questions you'll be getting from each and every series, the type of questions. So, from that, in pathology and lab, you will be getting 6 questions. Okay. And as I told you, it's very easy to score marks, but just concentrate on the guidelines. There are few guidelines as well from this lab section. Okay. Because like guidelines like bundled and all those things, NCC edits, all those are there that I'll be discussing along with the practice questions. So friends, if you are new to the channel, please subscribe. Please like and share to among your friends. Okay, let's move to the video. So moving to the first question. Dr. Monday provided a comprehensive clinical pathology consultation at the request of Dr. Adams. This request was regarding a patient with various infections, drug allergies, skin rash, and Down syndrome. The patient is in the hospital ICU being treated with intravenous antibiotics. Dr. Monday did not see the patient, but he reviewed the patient's history, complex medical records, and provided a written report back to Dr. Adams regarding his findings and recommendations for further treatment. How would you report Dr. Monday services? Okay, how would Dr. Monday report his services? So here we have to quote for the services provided by Dr. Monday, and it's clearly mentioned in the question what type of service is being carried out. That's a clinical pathology consultation. Okay, comprehensive clinical pathology consultation. So obviously it should go under 80,000 series because clinical pathology consultation is being provided by Dr. Monday. Okay, so from that you can easily identify the answers, and from that you can easily skip out the options as well. Okay, so if you can check the options, first is 80505, that's the 80,000 series. Okay, pathology code. 99255, that is E&M code. 99255 is E&M code. This is not an E&M service. You have to code for Dr. Monday service. What is Dr. Monday service? Clinical pathology consultation. So you can skip it out, the E&M service. Okay. And if you can see option C and D again 99255, but along with that there is pathology codes are also mentioned, 80505 and 80504. But if in the question, if the question is regarding clinical to report the clinical pathology consultation, you don't have to code again E&M service. It will not come together because in the question it's clearly mentioned how will you report Dr. Monday services. So Dr. Monday service is, as I told you, it's clinical pathology consultation. So you have to code only the pathology consultation and not the E&M code. So you can directly skip out options B, C and D, which contains E&M service. Okay. So obviously your answer will be option A, 80505. Still, let's go and check what is 80505 and what is mentioned in the question. The request was regarding a patient with various infections, drug allergies, skin rash and Down syndrome. Obviously Down syndrome, all these are complex diagnosis, right? So the patient is in the hospital ICU. It's also mentioned that the patient is in the ICU for being treated with antibiotics. And then Dr. Monday did not see the patient but reviewed the patient's history, complex medical records. That is another important point. Complex. It's clearly mentioned that the patient is having complex EMR, medical record. So what is 80505? 80505 is the pathologist performs a clinical pathology consultation for highly complex clinical problem requiring a high level of medical judgment. Yes, this is a complex medical history, complex clinical problem. So 80505 is the correct code for the clinical pathology consultation. Okay, so here the answer is option A, 80505. Now moving to the second question. Patient is coming in for a pathological examination for ischemia in the left leg. The first specimen is 1.5 cm of a single portion of arterial plaque taken from the left common femoral artery. The second specimen is 8.5 into 2.5 cm across 1.5 cm in thickness of a cutaneous ulceration with fibropurulent material on the left leg. What surgical pathology codes should be reported by the pathologist? So here you have to code for the surgical pathology code. Okay, surgical pathology codes that ranges from which are the surgical pathology codes? Yeah, the one which is given in the options. It starts with 88300. Okay, 88300. So surgical pathology code you have to code here, and it's clearly mentioned that the first specimen is taken from the single portion of arterial plaque taken from the left femoral artery. So the first part should be from the one with left femoral artery, and then the second specimen is from the left leg. Okay, cutaneous ulceration on the left leg. So you have to find out that. It's easy to find out surgical pathology codes. If you check 88302, the first option 88302 and 304. What is 88302 and 304? You have to check whether the first specimen is from the left femoral artery and second one is from the left leg. You have to find out whether these two locations is included in the code. So when you check 88302, the first the first specimen is from the left femoral artery, which is not included in 88302. That is there in 88304. If you check 88304 code, you can see left femoral artery mentioned there. Artery. If you can check in A, artery, arteriomatous plaque. It's mentioned in the question, arterial plaque. So artery plaques. So 88304 should be the first code, the first specimen code. Okay, which is there in option B. The other codes are in the other options. It is the 88304 is not there. If you check option C, 88305. 88305 is for the left leg. The second specimen taken. Okay, leg is mentioned in the code 88305. Leg, toes is mentioned there. Okay, so 88304 and 88305. The first specimen code should be 88304 and then the second specimen code should be 88305. This is the easy way to find the answer for surgical pathology codes. Okay, and since this is being reported by the pathologist, you have to append it with modifier 26, the professional component. Append with modifier 26. Okay, so the answer will be option B, 88304 with modifier 26 and 88305 with modifier 26. Okay. Now moving to the third question. An 18-year-old female with a history of depression comes into the emergency room in a coma. The ER physician orders a drug screen on antidepressants, phenothiazines, and benzodiazepines. The lab performs a screening for each single drug classes using an immunoassay in a random access analyzer. Presence of antidepressants is found and a drug confirmation is performed to identify the particular antidepressant. What correct CPT codes are reported? Okay, so here you have to code for the antidepressant codes. Okay. Anyway, let's move directly to the first option, 80307 and 80338. What is 80307? Drug test. This is, of course, this is a drug test code. Okay, drug test presumptive, any number of drug classes. Here number of drug classes. Anyway, in the option it is mentioned any number of. In the code description it is mentioned any number of drug classes. So that's fine. Any number of devices or procedures by instrument chemistry analyzers. Yes, here immunoassay is being carried out in a random access analyzer. So this is being carried out by the instrument chemistry analyzer. Okay, so this have to be the first code. And here we have drug screen on antidepressants, thiazines, and benzodiazepines. There are three drugs present here. Okay. See the option B, 80307 times 3. That's a wrong code, because even though we have a three drugs present, what is the description for 80307? Any number of drug classes. So any number, it can be 1, it can be 2, it can be 3, it can be n number of drug classes. So even though one or more, even though n number of drug classes, you have to code only 80307 once. Okay. Now what is 80338? 80338 is antidepressants. Antidepressants not otherwise specified. Yeah, antidepressants also is mentioned, right? Yeah, presence of antidepressants is found and a drug confirmation is performed to identify the particular antidepressant. So it means presence of antidepressant is found, and then again a drug confirmation is carried out to confirm the antidepressant. So you have to code again the specific code for antidepressant, which is 80338. Okay, so like that you have to code. So obviously the answer will be option A, 80307 and 80338. All right. Hope you understand. Hope you understood why the antidepressant code has been coded here again, because it is mentioned in the last sentence that for the drug confirmation antidepressant presence, for the drug confirmation, the test is again carried out. So you have to code it again separately. Okay. Now moving to the fourth question. Sperm is being prepared through a washing method to get it ready for the insemination of 5 oocytes for fertilization by directly injecting the sperm into each oocyte. Choose the CPT codes to report the service. Okay. So sperm is being prepared through a washing method. So sperm washing. Okay, through a washing method, the sperm is being prepared for the insemination of 5 oocytes. Okay, so that you have to code. Moving to the codes directly, let's check into the options. What is the first one? 89257. Sperm identification from aspiration. This is not sperm identification. So you can skip that code. What is 89260 in option B? 89260, sperm isolation, simple preparation. Example, sperm wash. Yes, sperm wash and swim up for insemination or diagnosis with a semen analysis. Yes, this is sperm washing. So that code should be there as the primary one. And what is 89280? Same in option B, second code 89280. 89280. Assisted oocyte fertilization microtechnique less than or equal to 10 oocytes. Assisted oocyte fertilization. No, this is not assisted oocyte fertilization, right? So that is the wrong code, wrong option. What is option C? 89261. Anyway, we got 89260 as the initial code. Still check what is 89261. Same, sperm isolation complex preparation. Example, Percol gradient, albumin gradient. Now this is sperm washing only, which is the correct code as 89260. So go to option D. Again, 89260 is the code for sperm washing. And what is 89268? Insemination of oocytes. Yes, that is what we need, right? Insemination of 5 oocytes. So that is the second code, 89268. So obviously the answer will be option D, 89260 for the sperm washing, and then 89268 for the insemination of oocytes. Okay. Let's look into fifth question. During a craniectomy, the surgeon performed a frozen section of a large piece of tumor and sent it to pathology. The pathologist received a rubbery pinkish tan tissue measuring in aggregate 3 into 0.8 into 0.8 centimeter. The entire specimen is submitted in one block and a microscope was used to examine the tissue. The frozen section and the pathology report are sent back to the surgeon, indicating that the tumor was a medulloblastoma. What CPT codes will the pathologist report? What is the first code? 80500. That is clinical pathology consultation. This is not clinical pathology consultation. Okay. What is option B? 88331. 88331. Pathology consultation during surgery. Clinical pathology consultation is the code 80500, but this is surgical consultation for pathology, right? Because it's mentioned there that the tumor as it's for the tumor which is going to be removed, and the tumor was a medulloblastoma after the confirmation from the lab. So this, it means it is a the procedure is carried out during a craniectomy, so it means this is a surgical pathology consultation. Okay, so surgical pathology consultation code is 88331. Pathology consultation during surgery. First tissue block with frozen section, single specimen. First tissue block. How many tissue blocks are here as per the question? The entire specimen is submitted in one block. Yes, so here the entire specimen is carried out in one tissue block. So only one tissue block we have. Okay, and the frozen section was sent back to the surgeon. Yeah, so 88331 is the correct code here. If you check again, option C 80502, again it is clinical pathology consultation, which is wrong. Option D 88331 is there, and then 88304, one more code. What is 88304? Surgical pathology consultation, gross and microscopic examination, that is again marked separately, surgical pathology consultation. But here in the code 88331, if you can check the description, 88331, pathology consultation, what is the exact description of the code 88331? Don't be confused with options B and D. 88331 is pathology consultation during surgery, first tissue block. So here the surgical pathology consultation is included, as well as the first tissue block is also included. Both are included in the single code 88331. If there is a single code, combination code, you have to always use only that one. You should not report it separately again as a surgical pathology consultation. 88304 code is again surgical pathology consultation, but you don't have to code it separately because in the code 88331 description, it is already mentioned that surgical pathology consultation along with the tissue block included. Okay, so go for the combination code. So the answer will be only 88331. Answer will be option B 88331. And since the procedure is being carried out by the pathologist itself, you have to append it with modifier 26, professional component. Okay, so answer is option B. So friends, that's all for today, and hope you like the video. Please like and share it among your friends. If you have any queries, please mark it in the comments, and I'll be getting back to you soon as soon as possible. And many apologies for the delay in the videos because I was out of country. So that's the reason I couldn't post videos on time. Now I'll be coming back. I'll be coming with regularly, like I'm trying my best at least to upload 3 or 4 videos in a week. So friends, please stay tuned and please support me as earlier. And yeah, I'll be coming back again in the next episode with more questions and guidelines. If you are new to the channel, please support me by subscribing to the channel. And thank you so much. Stay tuned again, and let's see you in the next episode. Bye. Take care.